Hi, my name is Lucia Martinez and I will be discussing the stereotypes about aging. Stereotypes are beliefs about a particular group often adopted as shortcuts to size up people when we first meet them. In other words, we use stereotypes to help us process information when engaged in social interactions. What it means to be old is based on an ongoing interaction between self, society, and culture that's developed over time. Ageism is a prejudice against older people. It is also something we will all experience. Stereotypes are not always negative, but they are often applied in ways that underestimate the potential of the person we're observing, resulting in discrimination and prejudice. Older adults are subjected to conflicting stereotypes. On the one hand, older adults are seen as grouchy, forgetful, losing physical stamina, sexual abilities. They are perceived as incapable, dependent, and childlike, deteriorated, and close to death. They are also considered less intelligent, less ambitious, and are treated as second-class citizens and viewed as having little to offer to society. In contrast, these same behaviors in young adults hold very different meanings for most people. Stress, preoccupation, lack of attention, and other explanations are used. The cause is usually never attributed to a younger adult's declining cognitive ability, exemplifying the age-based double standard, which is when an individual attributes an older person's failure in memory as more serious than a memory failure observed in a young adult. Positive stereotypes of older adults are that they are wise, generous, and responsible, and they can also be seen as cooperative, considerate, patient, and sociable. Stereotypes become overlearned and are thus spontaneously activated when we encounter a member or members of a stereotype group. The activation of stereotypes is called implicit stereotyping, which is unconscious, so it is most likely to influence our behavior without us being aware of it. Ageism incorporates three components: cognitive, affective, and behavioral. They can also be explicit, which are conscious, or implicit, which are unconscious. For example, a stereotype of older people being hard of hearing and cognitively declining can lead people to use patronizing communication methods, such as baby talk or over-accommodation. The stereotyping and stigma of older adults can lead to self-stereotyping and self-stigma. Stereotypes are learned and reinforced throughout the life and can be unconscious. Although the research into self-stereotypes highlights increased negative outcomes, the other side is that positive self-perceptions of aging have been shown to have positive outcomes, such as increased longevity. Stereotype threat is an invoked fear of being judged in accordance with a negative stereotype about a group to which an individual belongs. Often unknowingly, older people incorporate these stereotypes into their own thinking and self-perception. It has been found that negative stereotypes have detrimental effects on the stereotyped group, such as increased anxiety levels and lower motivation, which in turn may result in low levels of performance that conforms to the stereotype expectation they are trying to avoid. So, overall, we should be cognizant of what stereotypes we are using and how this may affect others. Thank you for watching.